should avoid the radioactive scanners, or what are they called? X-ray thing machines. But then I've also heard they're really not that dangerous, that making a phone call on your cell phone actually has more radiation than that does.
Rather be safe than sorry.
Why not just be safe? And you can just go through and get a little pat down.
Once you get past security, you have to make sure your pregnant wife is substantially fulfilled her craving with healthy food.
We were running late this morning, so we didn't get a chance to eat breakfast, so we gotta eat now. It's always good to stay hydrated when you're traveling too, even when you're not pregnant, but especially when you're pregnant, because something about flying really kind of can get you dehydrated. Even though you have to get up and pee, you still should drink your water. Two important things that I've learned about the actual plane are, one, make sure you get an aisle seat, because not only are you going to have to go to the bathroom a lot, but it's good to get up and stretch your legs. From what I read in my research, like every hour, because you're more prone to blood clots and swelling and stuff in your legs when you're pregnant.
Get in the aisle seat.
Yes. Now I don't have to bug anybody when I have to get up. Bathroom break. And the other thing is to go to the bathroom before the plane takes off. Wait till the last minute and go, because you know you're going to have to get up. You never know how long you're going to be stuck on the runway or the tarmac or whatever it's called. You don't want to have to be sitting in your seat just having to go. Another important thing is to wash your hands a lot as much as you're going to the bathroom. Bring some hand sanitizer too in case, because your immune system is already weaker when you're pregnant, and you do not need to be getting sick with all the nasty germy planes like this that I just dropped on the floor.
Don't let your pregnant wife carry any baggage. We don't need her getting hurt. I'll get everything fixed.
Oh, thanks, babe. I'm glad I had you there to carry my bags
Oh
for me.
my gosh, would the weekend ever end?
دوستان به برنامه مامتاک خوش آمدید. این برنامه امروز در رابطه با مسافرت و مسافرت خانواده ها و اینکه چگونه میتوانند آنانی که شاید حاملگی دارند یا حامله هستند یا قصد حاملگی دارند برای مسافرت خودشون را آماده بکنند. در این بخش برنامه با خانم دکتر امیلی سیکینگ که با ایشون آشنایی دارین از جلسات گذشته، ایشون در از دکتر مامتاک ما هستند و دکتر زنان هستند، تخصصشون دکتر زنان هستند و بسیار بسیار دقیق و ظریف با علم بالایی که دارن قراره که در رابطه با مسافرت کردن و آمادگی برای مسافرت ما رو آگاه بکنن. به برنامه مامتاک خوش آمدید. Dr. Sikking, welcome to MomTalk.
Thank you for having me.
Awesome. So we watched this cute couple at baby steps. They're going step by step over some of the things that we can kind of be aware of, pay attention to. What are your tips and what you just watched? Yeah.
So generally, I tell my patients several different things, especially when they're pregnant. In the beginning of pregnancy, most people don't know that they're pregnant, and travel is definitely something that people do. So to definitely be aware of whether you're pregnant or not is a good idea. Mm-hmm. Hydration is very important. You definitely want to make sure that you're staying hydrated. Getting dehydrated can definitely result in being much more fatigued and having other issues. And my rule of thumb has always been with hydration, which is preferably 3 liters a day, which seems like a lot of fluid, but that's just sort of a rule of thumb. So I usually say somewhere around 3 liters. I usually say try to get 2 liters in before 2, because then you're not up all night peeing. But
what are some ways to be aware of your level of hydration? I know with our family, we always ask the kids to just pay attention to the color of the urine, right? Yep. Is that something you recommend?
That's pretty much what I say. If it's clear, then you're good.
Okay.
If you're urinating and it's clear fluid, if you take a vitamin or if you have something in your diet that changes the color, which can sometimes happen, like vitamins and things like that, that can definitely change the way it looks, but it won't change the whether it's concentrated or not. So you're looking for it to be fairly clear and translucent. So that's the key. And that's obviously a very important thing when you're pregnant, because you can get very hemodynamically concentrated, and you want to make sure that you're staying very well hydrated. The other primary thing that I actually tell all of my patients when they travel is that if you're going to be sitting any place for more than 90 minutes, that you need to get up and move around. And when my patients travel by plane or when they travel by car, or when they travel, train is a little bit different, or by bus, that if you're going to be traveling for more than 90 minutes, you should really be wearing compression stockings or getting up and moving around every 90 minutes, which is hard to do in a car sometimes, although generally you need to pee probably every 90 minutes when you're pregnant, just because of the amount of hydration that you're taking in and also because of the way that your blood flow works and how it's filtering through your kidneys. So you do have more volume that you actually expel. But the blood clots, the risk is so much greater when you're pregnant, and that's not only from the very minute you get pregnant, but it actually goes until 6 weeks postpartum. So during that entire time period, if you're going to be traveling, I do recommend to my patients that they pick up compression stockings. They're not the most comfortable things in the world, but they have gotten much more fashionable. You can find them online at various different places, and you can find them. Jobst, J-O-B-S-T, is one of the most common ones. But you do want to get something that's more than just a Spanx legging. You want to get something that actually is going to keep the blood flow moving throughout your lower extremities, particularly. It'll also make you feel better. Your feet won't get as swollen. You'll be able to get up and move around easier. And actually, when you arrive wherever you are and then you end up taking them off, you'll feel better. Which I think is really important, because when your feet get really swollen, it's really hard to move, especially when you're traveling, which most people are on their feet moving more when they're traveling than when they're not. So I think it's important to be able to get up, move, and feel comfortable. Some people say various different things. Some people say you should take a baby aspirin whenever you travel. I don't necessarily agree with that, but certainly it's a conversation you can have with your physician at the time. The airlines have a different perspective on their employees and whether they can travel while they're pregnant. Each airline does different things. In the past, historically, they have not allowed women to travel as soon as they become pregnant. Those studies are very weak. It's hard to know whether travel has an impact on fertility or on your pregnancy. Some people believe that it does. I think more of it has to do with just the stress that goes along with travel, no matter whether you're just going for a 2-hour flight and that's part of your job, or whether you are traveling to go on vacation for a week, or whether you're crossing the country. I think that those can be very different in the stress that they cause on your body, but it is relevant, and it is important to understand that when you get into an airplane, you're in a compressed environment, that the air is circulating differently. Your risk of getting an infection is greater just by the fact that the air is being circulated, as much as they try to filter it. And during certain seasons of the year, when there's high flu seasons, I definitely encourage my patients when they're going to travel to really be cautious, really good hand washing. Hand hygiene is what I refer to it as, and making sure that they're really paying attention, that they're actually washing their hands well, making sure that when they're touching things that they're not then touching food that they're going to touch with their hands, and to just be a little bit more cognizant. And if somebody's sick nearby, to try to keep your cleanliness aware. There are some people who do believe that wearing a mask on the plane when you're pregnant is recommended. I think that's a personal decision. I wouldn't discourage it if somebody wanted to do it, but I think it might be a little excessive for the general pregnant woman, but I don't think that it's necessarily a terrible idea. You're trying to protect yourself during a time when you're pregnant, where you're vulnerable and you're carrying a baby, and your body's purpose at that time period is to be essentially growing and cooking your baby. So your efforts and your energy that your body's putting in are going towards that purpose. They're not necessarily going towards fighting off infections. But people get sick when they're pregnant, and it's absolutely fine. You can be treated. There are antibiotics you can take. There's no risk with that. But in general, sort of my rule of thumbs are hydration, compression stockings, make sure that you're moving around and mobile, and that you keep good hand washing in order to decrease your risk of an infection.
Awesome. very, very precise, accurate. I'm just going to take a moment to translate these 3 tips. برای شما دوستانی که مسافرت میکنین و در دوران حاملگیتون مسافرت میکنین 3 مورد هستش که باید بهش اهمیت بسیار زیادی داده بشه. مورد اول این هستش که جوراب‌های مخصوص حاملگی هستن که این جوراب‌ها رو میتونین آنلاین تهیه بکنین و این جوراب‌ها کمک میکنه که به اصطلاح گردش خون رو در پای شما و در رگ‌های شما عروق تنظیم میکنه که فشار شما تحولات خطرناک درش اتفاق نیفته. بنابراین این کار میتونه مسافرت شما رو بهش راحتی بده و با آرامش بیشتری شما مسافرت بکنین. مورد دوم این هستش که باید آب زیاد و آب فراوون، نوشیدنی فراوون میل بکنین و مطمئن باشین که بدن شما هایدریتد هستش و کمبود آب نداره. بنابراین آب زیاد در دوران به اصطلاح مسافرت بسیار بسیار مهم هستش و به خصوص برای کودکان، بچه‌ها و مادرانی که حامله هستند. در دوران مسافرت آب فراوون بنوشین و مطمئن باشین که هایدریشن بدنتون بالا هستش. مورد سوم این هستش که به اصطلاح در رابطه با حرکتتون یا هر 60 تا 90 دقیقه‌ای بلند بشین و بدنتون رو به اصطلاح به قول معروف استرچ بکنین، یه مقدار راه برین و با این راه رفتن و استرچ کردن به شما کمک میکنه که گردش خونتون به اصطلاح بیشتر باشه و خطرناک نباشه برای دوران حاملگی. They also talked about taking the aisle seats, and they were referring to using the bathroom before the flight. Are those tips helpful? Do you think that would make it a little more peaceful?
I think it's helpful in general, but I think some people like to sit at a window and some people like to sit at an aisle, and I think that you should sit wherever you want to sit. Obviously, you're going to intrude on your fellow flyers and passengers by getting up a lot, because generally you do get up and go to the bathroom more frequently when you're pregnant. So out of courtesy, yes, and probably out of convenience, it would be much nicer to be able to sit on an aisle, but that's not always going to happen. We like to think that it would. You certainly want to let the flight attendants know when you're pregnant, because it does give them a little bit of a heads up. They're going to be a little bit quicker to bring you some water when you're asking for it. Maybe they'll provide you an extra glass instead of just giving you one glass. They might give you 2, or they might just give you the bottle, which is probably a good idea. But, you know, it's harder to bring water onto the plane. You have to buy it in between. But yes, absolutely. I mean, getting up and moving around also is just a good idea.
Awesome. All right, so just getting around and moving. حرکت فراوون، فعالیت در راه به خصوص مسافرت‌های طولانی. میدونم از میدل ایست یا از اینجا به میدل ایست رفتن ساعت‌های طولانی شما در هواپیما هستین. چند تا از دوستای خود من که حامله بودن به ایران سفر کرده بودن و این مسافرت خیلی طولانی هستش. برای همین مطمئن باشین که آب فراوون میل می‌کنین، می‌نوشین و در کنارش حرکتتون در هنگام مسافرت بالا هستش و اون جوراب هم کمک میکنه. The X-ray machine. Sometimes you know moms are concerned. Do we go through it? What are your recommendations?
The X-ray machine is actually very safe.
It is.
It does not exude large amounts of radiation, but at any time that you are pregnant, that you are with child, that the baby is growing and going through all of that development, you always want to decrease the amount of exposure that you're going to be putting your unborn fetus through. So I usually say, if you can just have them pat you down or go through a different way, that's always a better idea.
Okay.
But the risk is really not that great. If you go through the detectors and then you find out that you're pregnant, it's not going to cause undue damage to your child.
Okay, great. So this is just getting to your destination. Once you're at your destination, let's say someplace in the Middle East, Turkey, Iran, Greece, now you're in a new environment. Yep. You're exposed to new bacteria and new food and water. Everything. So what are some suggestions? How do we keep safe as a pregnant mom?
I always say the easiest one for me to use is Mexico because coming from California, it's really easy. And we know that the water there is not the same. They get sick when they come here. We get sick when we go there. Whose water's dirty? I don't know. It's just different. So what I generally say to most of my patients is sort of a rule of thumb. Keep it bottled. Make sure that there's no ice in anything. Because the ice comes from the tap water generally. It's not purified water before it goes in. So I generally say don't drink anything with ice. Drink it out of the bottle or out of the container. Better to do that. And then in addition to that, if you can peel it, you can eat it. So that means that if it's an orange or it's a cucumber and you can take the skin off with your own knife, then that's a good way to go. But if they're going to wash something and then hand it to you, you now have the water on it, and that's a risk. And generally what I usually tell most patients is try to stick with cuisine that you're familiar with. Don't try a new kind of meat you've never tried before, and make sure that whatever you do eat is cooked and well cooked.
اوکی. دوستان اگر مسافرت میکنین به کشور جدیدی توصیه میشه که حتما آبتون و یا نوشیدنی شما در شیشه باشه و تصفیه شده باشه و تولید شده باشه که مطمئناً اون باکتریاها و یا اون هرچی از محیط جدید هستش در بدن شما وارد نشه، به خصوص در دوران حاملگی. این تاکید میشه و اینکه اگر که میوه به اصطلاح میل میکنین مطمئن باشین که میوه‌ای باشه که بتونین پوستش رو به اصطلاح بکنین، مثل موز، مثل به اصطلاح خیار، مثل پرتقال، که پوست این رو خودتون بتونین بکنین و نه اینکه بشورنش و به آب زده بشه، برای اینکه در اون موقع هم میتونه این باکتریاها شما رو مریض بکنه. بنابراین اگر در دوران حاملگی به این نکات توجه بکنین، حاملگی سیفتر و به قول معروف امن‌تری خواهین داشت و با صلح و آرامش بهتری جلو میره. Another topic, hot topic, of course, is the Zika virus and some of these new
these new risks.
Disease,
and it's a different kind of risk factor that you're dealing with now, because those are things that are very detrimental. Zika's impact on pregnancy is the greatest issue. Its issue is not because you're going to get so sick, like from a bacteria of another kind. The issue with the Zika virus is that it is really related to pregnancy. And what it can do is it can actually cause what's called microcephaly, which is where the brain doesn't develop entirely normally, and it can cause a lot of issues with the baby. It's passed through a mosquito. It is predominantly in certain parts of the world. You can actually go to the Center of Disease Control online, and they will actually give you a list of all of the countries that have Zika, how much there is, and what your risks are, and actually how you can prevent it. The issue is that they do want you using a certain kind of sunscreen that has DEET in it, which is not recommended when you're pregnant. So that is one of the issues that we have. Now, do people still who are pregnant live in those areas and go? Of course they do. So we have to use our judgment. If someone comes to me and they say, I am going to be traveling to a Zika area, I would not recommend that they do that while they're pregnant. The interesting issue, though, is that you do have to actually get the mosquito bite and have symptoms of illness, which is usually fatigue and malaise, which is like a tiredness, sort of feels like you've got a little bit of a flu bug or something like that. Sometimes you can get a little bit of GI upset, but generally speaking, it's just kind of an all-over sort of feeling like you have the flu. So you have to get bit, you have to have the symptoms, and then you can be tested for it. So the important thing is that for women, if you are not pregnant, then your risk is actually, once you get through that, then there's a time period at which you're fine. With men, because they think the virus actually can go into the semen, their risk of then infecting a woman after the fact is actually a lot longer. So one of the things that came about is that a man who might have traveled, even if their pregnant wife does not travel, if he travels and he gets an insect bite and he gets the malaise and he has the Zika virus, then they are not to be sexually active without a condom for a year.
Wow.
So
see, I didn't know that.
That's
Thank
pretty.
you,
That's pretty
Doctor.
big. That's a big.
That's a big
so
one.
That's something to really take into account when
Sure.
you're choosing your travel plans. The good news is that most traveling has insurance now, so you can usually get your traveler's insurance, and most doctors will write letters on your behalf in order to help with that. So if you do have travel planned and you find out that you're pregnant or that your wife is pregnant and you need to make some adjustments, then you can obviously.
Wonderful. Well, this is very important, so I feel like I need to translate every bit of this information. دوستان در رابطه با زیکا ویروس یا پشه زیکا صحبت می‌کنیم و دکتر امیلی سیکینگ به این نکته بسیار مهم اشاره می‌کنن که فقط مادران نیستن که در دوران حاملگی با به اصطلاح این پشه زیکا قراره که به اصطلاح این ویروس بچه رو یا نطفه رو آسیب یا صدمه بزنه، بلکه پدران و مردانی که میرن مسافرت میکنن و اگر نیاز دارین که بدونین چه کشورهایی این زیکا ویروس یا پشه زیکا رو به اصطلاح درش هست و بیشتر آگاه بشین، به Center of Disease Control یا cdc.org تشریف ببرین. اونجا به شما تمام این به اصطلاح کشورهایی که زیکا و پشه زیکا و زیکا ویروس هستش رو به شما به اصطلاح آگاهتون میکنه و در این رابطه اگر شوهر شما، همسر شما یا دوست پسر شما مسافرت کرده باشه و او این پشه زده باشتش و او به اصطلاح این ویروس در بدنش باشه، از طریق سیمن و از طریق به اصطلاح سکس داشتن با این همسرتون یا دوست پسرتون میتونه این ویروس و این مریضی به زنتون یا همسرتون یا دوست دخترتون منتقل بشه. بنابراین این از اون نکته‌های بسیار مهمی هستش که من خودم نمیدونستم این رو و باید بهش توجه بکنیم و خیلی میتونه کمک بکنه که کنترل بکنیم دیزیز رو و به اصطلاح ریسک رو پایین بیاریم، چه در دوران حاملگی و چه غیره. Okay. Can you get tested? Like, are there ways to screen and get tested?
Yes,
Okay.
And there are various different tests that are out there. They're much more available than were before. You had to only go to a center. Now there are other places you can go. One of the places, at least for pregnant women, in your area is usually where the high-risk obstetrician is. That was one of the primary places if they were one of the locations. But now it's much more available. You can actually do it through various different labs. It's not quite as complicated or as unavailable, but the people who are going to be tested, they do like to test people appropriately. So we do want someone who's actually been to a Zika-infested area. We want someone who's actually been bit by a mosquito, and you want someone who's actually had some kind of physical response from the virus itself. So there are some criteria that they are using in order to decide who's the best person to actually be treated, to be tested, and then to be evaluated for that. So it's not like it's willy-nilly, anybody can go and get it. I guess you probably could if you wanted to, but there's a couple of hoops, but not quite as many as there were.
And like you said, if they're infected, if they have the Zika virus, then for a year they need to practice safe sex or use a condom.
If their wife is either pregnant or planning to become pregnant.
Got it.
Yes, because you don't want to infect her and then she would then the virus would be in her system and she would be at risk for giving it to the baby. Because this particular virus, not dissimilar to HIV or hepatitis B or hepatitis C, is a virus that is contracted through a mosquito because it is blood-borne, or through some sort of mucous membrane contact, which can get through into the bloodstream. So saliva, mucous membranes, semen, blood, those are the primary ways that these particular viruses, unlike, as an example, hepatitis A, which you get from food. And so it's totally different. So that virus doesn't have the same risks as a virus that is transmitted sexually or that is transmitted through body fluids.
Got it.
So very different.
Very important information. All on Mom Talk, you all. And check out Dr. Emily Sikking's website for all updates and wonderful information for our Mom Talk community and all you moms and families who like to stay aware and live consciously. This is great information. Thank you so much.
My pleasure.
Next topic, I wanted to ask you about vaccination. Vaccination is such a hot topic for adults, for children.
Absolutely.
What are your suggestions and recommendations? Common sense, what do we do? Like, do I need to get vaccinated at this age, or my children, do they need special vaccination?
Adults needing vaccines are based on travel. So again, we're back to that travel question.
Yeah.
So there are definitely places where you travel where you should definitely be vaccinated.
Okay.
And actually something that I meant to tell you was something that I do offer my patients, which is not necessarily offered by all patients, but a lot of travel doctors do have a package of antibiotics or medication that they give patients when they travel. I have my little package that I have come up with that are all pretty basic,
Wonderful.
straightforward, low side effect medications that can be used for various different things when you're traveling for a long period of time, or when you're traveling a long way from home, where you're not going to have access to pharmaceuticals and things like that. And I always want to make sure that we cover the GI issues, a urinary tract infection, a yeast infection, because these are all things that can really change your trip considerably. A respiratory infection. And those things can be very easily treated with a very simple a medication that's very well tolerated and generally will cover that particular thing. Do I want everybody having their little travel pack that they have at home just in case they get sick? No, that's not the idea. But this is under those circumstances when you're traveling. So for vaccines, there are certain parts of the world where you do have to get certain vaccines, yellow fever, and you need to be protected for typhoid and things like that. So and malaria. So there are things that you do need to be protected for. And you do want to make sure, I do always recommend that you go to a physician who actually has experience in travel specifically.
Okay.
I do think that's a smart thing to do. So vaccines, on the other hand, which is children and adults. So for children, I usually recommend that vaccines are a good thing. There are a lot of different theories about that, a lot of different philosophies about that. In the state of California now, you cannot go to school with other children without being vaccinated. So that is actually a mandate. So you must do that now, because they have actually proven that the person who came up with the whole theory that vaccines cause autism is completely debunked. He lied. He's been taken, basically his license has been taken away, and he admitted to absolutely fabricating all of the information. So there is no correlation between those two things, and nor has there ever been anything scientifically other than this one paper that came out that actually started kind of all of this. So vaccines, when I vaccinated my kids, so this is the way I did it, is that I didn't like my kids getting more than 3 vaccines at a time. So the way I look at it is, it's not 3 shots, it's 3 vaccines, because your body needs to make an immune response to that. The younger, or at certain age points in your life, there are times where your body responds well to those vaccines and responds well to that stimulation, so that your body makes this immune response, and it's actually a much better response that you can make depending upon what it is. So, but at the same time, I used to look at these kids who my kids were friends with, and they would come and they would have gotten 7 or 8 vaccines in one day, and they're sick and they're lethargic and their system can't handle it. So personally, I said 3. So if you have a measles, mumps, and rubella, that's 3, but it's 1 shot.
The MMR, right?
Exactly. Or pertussis, diphtheria, and tetanus. That's 3, but it's 1 shot. So I tried to space it out over a week or 2 just to give my kids' immune system an opportunity to actually really build an immune response to whatever it was that they were being vaccinated for.
Common sense.
It just seems commonsensical to me. Now, not every opportunity and not every person has that chance to be able to bring their child to the doctor as a patient intermittently, and you don't ever want to miss the opportunities to give those vaccines at the appropriate times, but if you can, I do suggest it, and I think it's a good idea. I think it just seems like smart medicine. For us, though, and for the older group. So the Gardasil vaccine, this is a big one. The Gardasil vaccine is the vaccine that we have that actually prevents against the human papillomavirus, which is the virus that is associated with cervical cancer. It's also associated with genital warts. So there's a high-risk group of HPV viruses, and there's a low-risk group. initially, the vaccine that came out for Gardasil had 2 of the most common high risk, which is 16 and 18, and then it had 2 of the most common low risk. They then came out with a second generation of it where it had more of the high risk type of viruses that it was covering for the vaccine. So there are a lot of people who say, well, do I need to get the new one? And do I need to go through the whole series? So the risks, first of all, the series is you get it once, you get it 2 months later, and then you get it 4 months after that. So it's over a 6-month period that you can get it. If you mess up on that exact cycle, it's fine. The first one's the most important one, but you definitely want to try to get those other 2, but the first one is the most important one to get. The side effects from the vaccine, the number one thing is a sore arm. It's a sore arm. It's fine. Most people can tolerate it. They're a little sore for a day or 2. Some people up to a week, but generally speaking, you recover pretty well from that. It is a vaccine that treats a virus that can cause cancer. This is not a nothing vaccine. This is a very valuable vaccine. There are some people who think that some people just don't make responses to vaccines, so maybe it's not as good as we think it is. But in fact, it's a wonderful vaccine. And the fact that we came out with something that you can treat both boys and girls with, women as they get older, if they have been in a monogamous relationship, they've never had the HPV virus, they've never had any issues with their pap smears, which is how we screen for it. And then let's say they are now in a new relationship, or they are going to be in new relationships, and they are having a new opportunity in their lives or a new chapter in their lives. I usually say, it's a good idea to get your vaccine. Protect yourself. You haven't been exposed to it yet, we think, because you don't always show the virus. We think, why not get vaccinated for it now, and let's prevent you from having a problem. There are a lot of different theories about that for men also. I mean, throat cancer is caused, we think, by HPV, and and men are getting it. I mean, Michael Douglas is a perfect example. He got throat cancer from the HPV virus. So it's not without risk, and the vaccine has great validity to it. Is it going to be perfect for everyone? Time will tell, but what we have right now is very good studies and very good literature that says that it's very worthwhile to go ahead and get that vaccine.
Wonderful. And do kids also recommend the children? Yeah.
So it's usually recommended that anytime after 9 years of age that they can get the HPV vaccine series. So 9 is definitely a little bit on the young side, but you know what? Better not to forget.
Right.
Better to do it than forget.
Okay. So در رابطه با به اصطلاح واکسن های مهم در رابطه با مسافرت ها، یه سری واکسن هایی هستن که خانم دکتر امیلی سیکینگ توصیه میکنن حتما با به اصطلاح استفاده از پزشک یا متخصصی که تخصصش در رابطه با مسافرت و ترافلینگ هستش. اینجا در آمریکا متخصصینی هستن، پزشکانی هستن که تخصصش به اصطلاح در رابطه با واکسن هایی که نیازمند هستن افرادی که مسافرت میکنن به یه سری کشورهایی به خصوص و از نظر دیزیز کنترل و اون ریسکایی که این افراد دارن میدونن که چگونه آگاه هستن که چگونه اونها رو محافظت بکنن و پروتکتشون بکنن. بنابراین پزشکی رو پیدا بکنین که تخصصش این هستش. How do travelers look for those professionals or they're doctors who are experts in this field?
You can actually look them up. Usually, if you have an insurance plan, then you can look it up through the insurance. If not, then you can usually look it up through travel guides. So a lot of the travel guides will have doctors who actually do that frequently, and they will actually have a specific, like in Santa Monica area, it's well known that Dr. Terry Rock is like the travel doctor. Absolutely.
Good to know.
I mean, she's a primary care doctor and she's a wonderful physician, but this is like her niche. You know, we all like having like a little something that makes us special in life. What's not like, and this is hers and she's terrific at it. And she knows all of the new rules and she's keeping up with all of that, which is always a good way to go. Your primary care doctor or your internist or family practitioner should know those things, but sometimes they're busy taking care of all of the other things, the pneumonia and the other, standard things that need to be evaluated, hypertension and all the different medications. So you know what? it's good to go to somebody
Find a
who's got a little bit of an itch where they're really going to make sure that you have everything done that you need to do in order to be safe.
Fantastic. Okay. So look for your specialist. اینو میتونین از طریق اینترنت و از طریق به اصطلاح ریسرچتون پیدا بکنین. دکترایی که حالا یا اینجا در آمریکا هستین یا در اروپا، دکترایی که تخصصشون کمک کردن مسافرین هست و حفاظت مسافرین در دوران مسافرت. در رابطه با واکسن‌های دیگه HPV و واکسنایی که به اصطلاح واکسنای پیشگیری هستش و به خصوص در رابطه با سرطان و مریضی سرطان، این واکسنا میتونه خیلی مفید باشه. اینجا در آمریکا به اصطلاح توصیه میکنن به خصوص کودکانی که در ریسک هستن در سنین 9 یا 10 سالگی این واکسن HPV رو بگیرن، به خاطر اینکه تحقیقات نشون داده که میتونه پیشگیری بکنه از گرفتن سرطان‌هایی مثل سرطان به اصطلاح گلو و غیره. بنابراین در این موارد هم آگاه بودن و اینکه چه واکسنایی رو استفاده بکنیم در رابطه با پیشگیری مریضی، به خصوص مریضی‌هایی مثل سرطان که میدونم خیلی از ماها دوست داریم بیشتر آگاه باشیم و بدونیم که چگونه این پیشگیری رو انجام بدیم. Wonderful. So you were talking about your traveling kit. I'm curious. Now I want to know.
Okay, so my travel kit that I usually give patients is a Z-Pack, which helps with an upper respiratory or an infection that can be a sinus infection.
Okay.
It can help with GI things, and it can help with other stuff. So that's pretty much a really good, solid basic to start with. Macrobid, which is a great medication for urinary tract infections, and a urinary tract infection can blossom very quickly, especially when you're traveling, you're not in your regular habitat, you're not doing your regular things, or, you know, if you're going on vacation and you get urinary tract infections if you're a little bit more sexually active and you haven't been at that point, then that can do it too. So having something for the bladder infection is key. A yeast infection, because you're maybe not showering as regularly, or maybe you're in some place where you're sweating more, or you're running around and you're getting more moisture, and that's going to happen.
Especially pools and jacuzzis and being exposed to, I mean, we just got back from Atlantis water parks and, you know, you were just exposed, right?
Absolutely. So, and that's an easy thing to do. That's diflucan. You just take that. I usually give patients 2 tablets that they can take. And then we start moving into the other things where you're talking about maybe having a Tamiflu, which is the antiviral medication, which is what you would take if you were traveling and you got on a plane and you caught something and you weren't really sure what it was. That can sometimes help a lot. And then there's a medication called Cipro. And ciprofloxacin is a medication that you do need to be a little bit careful with because it's in a category of medications that can cause tendon weakness. So it has been associated with Achilles tendon ruptures that can occur or various different other places. So it needs to be taken somewhat with some caution, but you're not taking it for a long period of time. You usually only take it for 3 to 5 days. It's great for bladder infections, and it's also fabulous for a really bad GI upset. So when somebody gets a really bad gastrointestinal bug, the Cipro is very good for that. So those are sort of the primary ones that I like to use.
If you're pregnant, though...
you cannot take Cipro.
Okay.
But all the other ones, other than the diflucan you can't take either, although it's probably safer in pregnancy than we think, but we just don't test it. Instead, just picking up an over-the-counter anti-yeast medication is probably good just to run around with the monostat. You can just throw that in your bag, too. So those are sort of the basic ones that I tend to have for patients to travel with.
Awesome. در رابطه با مسافرت کردن، میدونم یه سوالی که برای خیلی از شما مادران و پدران پیش میاد، من خودم میدونم در آفیس من از من سوال کردین، ما میتونیم مسافرت بکنیم خانم دکتر؟ سیف هستش ما مسافرت بکنیم؟ That's one of the first questions that expecting, especially new first timers. They said, is it safe for us to travel?
That's right.
So it is.
It is safe. It is safe. I mean, you want to have caution. You know, you want to be responsible and you want to be cognizant. You're not traveling just as a, you know, free to be you and me 18, 20-year-olds. You're traveling as a pregnant woman, and you now have a baby inside of you, and it is your undue responsibility to take care of that.
Does it matter where in the cycle, the trimester, are there safer periods, for example, like the second trimester? What are those safer zones for traveling?
So the safest zone is usually the second trimester. It's sort of the honeymoon period. Unfortunately, the second trimester is really only 10 weeks, so it's a very short period of time because the first trimester is really So an entire pregnancy is theoretically, in the United States, we refer to it as 40 weeks, but you're actually only 38 weeks of pregnancies. From the time of conception to the time of delivery, theoretically, is 38 weeks. So but we tack 2 on because that's just the way we do it. So the first trimester is over at about 14 weeks. So in the first trimester, it's during most of the developmental time where the baby's actually developing and the organogenesis. All of those things are going on. So you want to decrease your exposure risk, and you want to decrease the things that the baby might be exposed to, and you might not necessarily be feeling very well. First trimester can be a little tricky for a lot of women. They can be very nauseous. They can not feel well. That is also, that's also one of the other medications I give patients. A little Zofran.
Oh, that's right.
It's always a good one to travel
I remember
with.
that.
But now we have wonderful other medications out. We have a medication called Diclegis, which is actually vitamin Bs and an antihistamine, and it works beautifully for women who are nauseous and want to take something that they think is safe, and it's much safer in general because it's been around for such a long time. But then from 14 to 24 weeks is pretty much the second trimester. So you're only talking about 10 weeks. And that's usually your honeymoon period where you're starting to feel better. You got more energy. It's a little tricky.
I remember those days.
Yeah, it's a little tricky time because you don't really look pregnant. You don't feel pregnant, but you don't kind of look like you.
You have that glow, the honeymoon glow.
You have the glow. And you feel like you've got more energy, a little lease on life. And so a lot of women that's a good time to travel. From 24 to 36 weeks is always, or 24 to 34 weeks, is usually a period of time where travel is safe, but you definitely want to be a little bit more cautious. You want to make sure that you are wearing your compression stockings, definitely, just if for no other reason than for the swelling purposes when you get on an airplane, because most people swell on an airplane. And the hydration, because you really start going to the bathroom more frequently and you're just not quite as comfortable. So there is that sort of uncomfortable component, but travel is safe. Now, I will say that I have had this happen a couple of times, so I have to be careful what I say. But each airline can have different rules. So some airlines say you can travel as late as you want to. And some say, we don't let you travel after 36 weeks. So it does depend on what you're traveling, where you're traveling to, if you're doing international travel or if you're not. So it does make a difference for that. So I would always check with the airline that I'm traveling on to make sure that I'm not going to have a problem, because I have had to write letters for patients who need to travel for an emergency or for some other reason, and I have to write that what their weeks of pregnancy are and that they are safe to travel, and it becomes my responsibility instead of the airlines.
Oh, interesting.
Yeah.
So دوستان اگر در رابطه با مسافرت کردن به اصطلاح با traveling agencyتون یا ایرلاینتون مشورت بکنین، بهتر آگاهتر خواهیم بود، برای اینکه بعضی از به اصطلاح بعضی از ایرلاینا ریکوایرمنت های خودشونو دارن، بعضیا از 36 هفتگی به بعد نمیذارن، سیف نمیدونن، امن نمیدونن مسافرت کردن، و برای همین حتما با traveling ایجنتتون و با کسی که شما رو کمک داره میکنه در بلیط گرفتن و به اصطلاح مسافرت کردنتون مشورت بکنین و مطمئن باشین که برای شما مقدور هستش که مسافرت بکنیم. I know I had a client who really, I mean, she was desperate. Her father was ill and she was really desperate to travel. And I think that after going through, getting the letters from she really, they still would not let her go because it wasn't safe. And it was a sad situation. So make sure that you check and make sure that
insurance.
Travel's insurance. That's right.
Safe.
So that's always nice to be safe and to get your
$25
refund.
it's worth it.
That's right. That's right. It is. دوستان نکات بسیار بسیار مهمی را خانم دکتر امیلی سیکینگ مطرح میکنن در رابطه با مسافرت. به وبسایت ایشون تشریف ببرین www.EmilySikkingOBGYN.com. ایشون نه تنها از بهترین دانشگاه ها به اصطلاح فارغ التحصیل شدن، بلکه اینجا در سانتا مونیکا و سنت جانز هاسپیتال و به اصطلاح یک گروه به خصوص زنانی که بسیار بسیار به اصطلاح اصطلاح آگاه هستن، عالم هستن و فعالیت میکنن و در رابطه با به اصطلاح ارتقاء آگاهی در کامیونیتی زنان و مادران بسیار بسیار فعالن و میکوشن و من یکی که خیلی از به اصطلاح نکاتی که ایشون همیشه صحبت میکنن بهره میبرم و دوست دارم ملاقاتایی که با هم داریم برای اینکه منو بیشتر آگاه میکنه، نه تنها به عنوان یک مادر و به عنوان یک همسر بلکه به عنوان یک زن و بدونم که حقوق من چی هستش، چه کارایی میبایست بکنم که از بدنم نگهداری بکنم. This goes back to our conversation on self-compassion and self-care and how critical it is, especially for women. And I know you women in the Middle East, sometimes, you know, you give too much or you're paying attention to the family and taking care of everyone else's needs and your needs come last. And so it's really important to raise awareness on these topics and how to really pay attention. I love watching the clip that we saw with the cute couple, how the father was so involved.
I loved it.
He was just taking care of
It's wonderful.
his pregnant wife and really paying attention and making sure that that's right. برای همین شما همسران عزیز، آقایون عزیز که با خانومتون مسافرت میکنین حتما مواظب باشین، از اون مواظبت بکنین، لاگیج یا بار رو بگیرین و نذارین که او بار رو بکشه. I see sometimes when we're traveling, I see some of these Middle Eastern women, you know, carrying bags and the babies like, you know, on them. And I just, you know, and sometimes the husband or the, you know, the man is walking like 3-4 steps ahead of the one. And I'm just thinking, you know, really, like she's pregnant, you know. Have a little like compassion, have a little empathy. Yeah, so we got to raise awareness. I get not the modern generation, though. I have to say that the new generation, you men and dads and husbands who are from the modern world, I know in the Middle East, you do pay a lot of attention and you do care about your wives and you do take care of them, which is lovely to see. Because when you have a healthy wife, when you have a happy wife, your life, the quality of your life will improve. I promise you. Having and for you women, having self-compassion and self-care and being happier and having this peace learning grow inside of you from the inside out is going to help your family. Your whole family will benefit from this and the whole world ultimately. So these conversations are important. What you do, Dr. Sikking, bringing beautiful babies into the world. My own babies, she brought them. And I remember my pregnancy. It was so blissful. It was so beautiful. Even at times when, you know, of course, there are risks with twin pregnancies. I was always feeling safe and that I could go to Dr. Sikking and ask any questions and get all the information and be aware and have that self-care that I deserve and my children deserve and my family deserves. So it's always nice to find a practitioner who cares, who values self-compassion, and certainly like, you know, I think there's a lot of research on this now that caretakers or care providers, practitioners who score high on self-compassion are much more likely to have healthier patients and have healthier pregnancies with their patients and so forth.
Those statistics are very solid.
Yeah.
It's really important. It's important to have a relationship with your patients. It's really, really important. It's important to have a relationship with your doctor. And you got to sometimes keep searching until you find the right one. I'm not perfect for everybody, but you know, you got to find the right one that's right for you. I think it's really key.
All right. Well, thank you for being on Mom Talk again.
Thank you for having me.
We love you. And until next time, peace.